Welcome to today's program titled Return to Business, Phase 2 of Massachusetts Reopening, an overview for restaurants, hotels, retail, and other businesses. At this time, all participants are in a listen-only mode. For those of you who are logged into the web presentation, you're encouraged to submit questions throughout the conference by typing them into the text box on your screen. For those interested in obtaining CLE credit for this webinar, an attendance verification code will be read during the presentation that will be required on the CLE attendance affirmation form. Please write this code down. It will not be reread, and it is required for CLE credit. Copies of the webinar recording and materials will be distributed to attendees in the days following the webinar. At this time, I would like to turn it over to Dan Klein. You may begin.
Thank you. Good afternoon, everyone. Thank you and welcome to our discussion on Phase 2 of the Massachusetts reopening. I'm Dan Klein, a partner in our Labor and Employment Group here in Boston, and joining me today are my partner Ariel Sokovich and our associates Chris Kelleher and Emily Miller. Before we get started, I'd like to take a moment to address the deeply distressing events unfolding in our country. My colleagues and I share the horror and dismay that many of you feel when witnessing acts of racially motivated violence against our fellow human beings. The violence only makes things more difficult for a community that has been disproportionately affected by COVID-19. While our presentation is focused on returning to business through the COVID-19 pandemic, the events that have occurred over the last week plus will also affect companies reopening across the nation and certainly in Boston and throughout Massachusetts. We will keep all of that in mind. Now, for a few housekeeping items, for those of you seeking CLE credit, Emily will announce the CLE code towards the end of the presentation. A CLE form will be emailed to you following today's program that you will use in conjunction with the code, so please be sure to write it down when Emily announces it towards the end. Finally, we've allotted about 15 minutes at the end of our program to address questions, so we'll have about an hour's worth of content. We may finish a little under that, but we've added that extra 15 minutes for questions at the end. As the host moderator noted, you can send your questions via the chat feature of the webinar platform, and we'll address them at the end of the content. Now let's get started. Just to go over today's agenda, we are going to provide an overview of Phase 2 of the state reopening plan. Hopefully, those of you affected by Phase 1 were able to attend our May 21st program on Phase 1. So some of the safety protocols we discuss, which are going to be the second item on your agenda in front of you, the mandatory safety protocols, those will be similar to what you heard last time if you did attend, but they do apply to all sectors, and from what the state has said, it will apply to all phases. So it's important that we address these today as we discuss Phase 2, and for those of you who are only being, your businesses are only being impacted for the first time now that we're turning to Phase 2. So we'll talk about Phase 2 generally, then we'll talk about those safety protocols, and Chris will handle that. Then Ariel will discuss some of the sector-specific protocols and best practices for restaurants. Ariel will then also do the same for hotels. He'll then turn it back over to Chris to discuss retail. And then Emily will discuss childcare and camps, all of which are going to be part of Phase 2. And then we'll finish with just a short preview of what's to come in Phase 3. So with that, let me just give you a little overview of where we are in the reopening plan in Phase 2 itself. As most of you probably know, here in Massachusetts, the reopening plan announced a number of weeks ago had 4 phases. The first phase was the start phase, where limited industries would resume operations in addition to the essential businesses that were already permitted to operate, with pretty significant restrictions. And that first phase was really focused on businesses where they were able to limit face-to-face interactions and close contact. Phase 1 was rolled out over 3 Mondays, the first being May 18th, then May 25th, and then this past Monday, June 1st. So each phase will last a minimum of 3 weeks, and they could last longer before moving to the next phase. It's going to be dependent on public health data, and if the trends are negative, then we may not move to the next phase, or even once we've moved, specific industries or specific regions or even the entire state may potentially return to an earlier phase. As I mentioned, we are going to discuss sectors, we're going to discuss safety protocols across all sectors, but then the state is also partnering with industries to draft sector-specific protocols in advance of future phases, and those are the protocols we're going to discuss today in advance of phase 2. So phase 2 is this cautious phase you see up here, which are additional industries resuming operations with related restrictions. That may start on Monday, June 8th. We do not have an official announcement yet. It's expected that the governor will make an announcement on Saturday as to whether the safety factors are comfortable enough to start phase 2 on time on Monday the 8th. It could potentially be at a later date, but at the earliest it'll be Monday the 8th, and we are now in the planning stages for that. That will last at least 3 weeks, and then phase 3 is the vigilant phase where additional industries will resume operations with further restrictions and guidance. And then at some point, hopefully sooner rather than later, we'll go into phase 4, the new normal, after a vaccine and therapies are ready. So in terms of phase 2, just a quick overview of which enterprises and industries are affected. Restaurants are now able to, will be able to resume on-site dining. They've already been allowed curbside pickup and delivery, but on-site dining will begin in phase 2, and we'll hear more about that in a bit from Ariel. Hotels, short-term lodgings will be part of phase 2. Retail stores, which have previously been allowed limited curbside pickup and remote ordering, will now be allowed in-store browsing and shopping in phase 2, and that's the non-essential retails. Obviously, essential were already open. And then certain personal services at fixed locations will be permitted to open. You see some of the specifics on the screen. It'll be in 2 steps. Driving schools, flight schools, non-athletic instructional classes, and arts education, life skills for under age 18, and even those will be in groups less than 10. Limited organized youth and adult sports, as long as there's no contact, and there will not be any games or scrimmages yet. Professional sports may resume practice and training, but no games with live audiences yet. Outdoor historical spaces may resume in phase 2, but not tours and functions yet. And funeral homes, which have been permitted to operate in a pretty limited capacity, will be able to increase capacity to 40% occupancy for one service at a time. Phase 2 enterprise that's authorized to open its brick and mortar premises to workers under under Monday's order will not be subject to the 10-person limitation on gatherings that applies to the public generally. Other industries or enterprises affected: warehouses and distribution centers in phase 2 may reopen. Golf facilities, including outdoor driving ranges, other outdoor recreational facilities, pools, playgrounds, etc., mini golf, etc., if they're outdoors. Day camps, Emily's going to talk about that. Public libraries and post-secondary higher ed and other trade and occupational schools may open for the limited purposes of students completing a degree or a program, or if it's a prerequisite for employment or other similar requirements. And for summer youth programming, including athletic facilities, etc. A couple things to keep in mind as you talk about phase 2. Beginning immediately, which means this week, this was from the order on Monday, phase 2 enterprises may open their physical brick and mortar premises this week to workers for the purpose of preparing for the phase 2 reopening that may come next week. In preparing premises for reopening, enterprises must at all times comply with all generally applicable safety rules and any relevant sector-specific rules, as we'll talk about today. So you may open this week for planning purposes only, as long as you're compliant with those restrictions. And as I said, we'll hear more, hopefully on Saturday, from the governor about a reopening date for phase 2. With that, I'm going to turn it over to Chris to discuss the mandatory safety protocols that go across all sectors.
Thanks, Dan. So as Dan mentioned, this will be the mandatory safety standards that all businesses should keep in mind. And a little bit later, we'll start drilling down into a few different of those sector-specific protocols. But for here, if you're open in phase 2, these requirements apply to your business. And before we move to the next slide, I want to just emphasize that they are, real requirements. The Attorney General has announced a new online complaint form for employees to report unsafe working conditions or failure to meet these safety standards. And local boards of health also have enforcement and investigation powers. So these are certainly real requirements. Next slide, please. So the mandatory workplace safety standards, these are the same standards that we saw in phase 1, and it appears that they'll apply until changed, perhaps for phase 3, but perhaps they'll remain the same. And there are 4 overarching categories that you'll see throughout, 4 themes that you'll see throughout today's presentation. They include social distancing, hygiene protocols, staffing and operations, and cleaning and disinfecting. And that 5th consideration there is the sector-specific protocols that we'll discuss a little bit later. With respect to essential businesses, those businesses that are permitted to open in phase 2, that are permitted to continue operating in phase 2, but were permitted to operate as a phase 2 as a essential business up to this point. You'll have about a week after the phase 2 begins to come into compliance with the workplace safety standards and the sector-specific protocols. So we expect phase 2 to begin on June 8th, as Dan mentioned. So in that case, an essential business that's already been operating will have until June 15th to come into compliance with these standards. Next slide, please. So the first and the overarching rule of compliance with Massachusetts COVID-19 laws is the 6-foot rule. All individuals, to the greatest extent possible, should remain 6 feet apart when we're returning to the workplace, and this includes both inside and outside of the workplace. And so the mandatory safety standards require that employers establish protocols to ensure that 6 feet of distance is maintained at all times when possible. Part of those requirements include posting notices and signage, which are available on the state's website, mass.gov/reopening. And there's also, as I'm sure you're all aware, a face covering requirement that will also be in effect when employees return to the workplace. Next slide, please. So with respect to social distancing protocols, the workplace is going to look a lot different than it did in probably early March when things closed down a bit. And part of what businesses will be required to do is reconfigure the workplace to allow for 6 feet of social distance. So this will look a little bit different depending on what type of business sector you're in, but generally moving workstations, creating directional aisles, physically creating barriers, taking steps to kind of reconfigure the workplace to allow 6 feet of distance. These are all requirements that you should be considering as we gear up to June 8th. Other considerations include repurposing customer areas and conference rooms that won't be necessarily used as conference rooms or lunch or break rooms. Repurposing those to allow more space and kind of limit bottlenecking and close configuration. In-person gatherings, of course, should be limited to the extent possible, and the posters I've already mentioned are available on the state's website and should be displayed ubiquitously to both employees and customers to notify them of these policies. Next slide, please. The social distancing protocols also include requirements to, if possible, stagger work schedules, break times, meal periods, things like that to avoid the bottlenecking I referenced earlier. if everyone is starting their shift at the same time, it's likely that there'll be some sort of congestion. So that's something that businesses should take into consideration as they're going back to the workplace. And also, while phase 2 businesses, telework might not be as possible as it was for phase 1 businesses, which included, office-based businesses, for instance. If there are employees who can telework and work from home, they should still be doing so under phase 2, and that'll help ease some of the congestion. Slide, please. Hygiene protocols is the second overarching category. As a general matter, employers and businesses are responsible for providing hand washing facilities and hand washing capabilities throughout the workplace, and ensuring that employees and those in the workplace are, well trained and understand the importance of sanitization and hand washing. If your business is the type of setup where hand washing facilities are not close by or readily available, the business should provide ample amounts of alcohol sanitizer, which is at least 60% alcohol. The business should regularly sanitize high-touch areas such as workstations, frequently touched equipment, doorknobs, restrooms, railings, etc. So as a general matter, the workplace should be cleaned, perhaps daily. But for the high-touch items, that cleaning should be done even more frequently, and employees should be encouraged to clean their own workstations as well. Next slide, please. On staffing and operations, I referenced training a little bit. Training should be provided to employees with regard to the new social distancing and hygiene protocols that they're going to step into this totally new environment that's totally unlike what they left back in March. And so it's important to train employees on the sector-specific protocols that we'll discuss in a few minutes. It's important to train employees that, if they have COVID-19 related symptoms, they should not be coming to work. And it's important to have a plan in the event someone does get sick with COVID-19 like symptoms. What do we do in that instance? In addition, if someone's been out for COVID-19 related symptoms, a return to work plan to allow those employees to come back into the workplace safely. Next slide, please. With respect to cleaning and disinfecting, establishing and maintaining cleaning protocols will be key, and tailoring those to the specific needs of the business. The phase 2 guidelines apply to restaurants, hotels, retail, and childcare centers, the sector-specific guidelines that we're going to talk about today. So 4 very different types of industries. So it's important to establish cleaning protocols that will be successful for your particular industry. In addition, as many of the sector-specific protocols require that logs are kept showing the date, time, and scope of that cleaning. As a side note, the local Board of Health, while these logs don't need to be provided to the local Board of Health, if there's an investigation at a later point, it'll be very helpful to have those around. When an employee is diagnosed with COVID-19, a deep cleaning and disinfecting must be performed. The site should be shut down to allow for that disinfection. And of course, it is of primary importance to disinfect all common areas, of course, appropriate to the workplace. Next slide, please. So the next couple slides are best practices that we discussed during our presentation of the phase 1 protocols. I won't spend too much time on them now, but this presentation will be made available to you later. And so we can go to the next slide, Dan. These cleaning and health and safety protocols, there are additional best practices here. Just wanted to flag them for you. Next slide, please. So pre-shift screening, under the Massachusetts order, and I'm sure you've all been watching the news and hearing about different state requirements. So Massachusetts, unlike some states, does not require mandatory temperature screening or health screening across all sectors at this time. But it may be a best practice or a good idea. And the EEOC has approved checking for symptoms and sending employees home who are symptomatic of COVID-19. So I wanted to just touch on the pre-shift screenings, which can be done, written, oral, through posting. Next slide, please. The CDC has frequently updated the questions that should be asked when conducting health screenings. And as I mentioned in the last slide, these questions can be in various forms. They can be text message to employees. They can be posted. They can be simple questions. So whatever works for the business. But they include, have you had COVID-19 related symptoms in the past 10 days? And we have a list of the most recently updated COVID-19 symptoms coming from the CDC. You'll notice that these last symptoms were updated on May 26th. They're regularly updated, and so it's important for employers to kind of stay up to date and understand, that the symptoms may change. Other questions include, have you had close contact with a person who has confirmed case of COVID-19? Have you had close contact with a person with COVID-19 related symptoms, and do you have a fever of 104 or greater? Next slide, please. Temperature screening, again, it's not required under the Massachusetts orders, but it's something that's approved by the EEOC. It can be done through a thermal or touch thermometer. It can be a simple self-assessment or oral confirmation by an employee that I don't have a fever today. But it's important to come up with a protocol and to stick to it. Some of the considerations that you should be thinking of: protecting the screener, the person responsible for screening employees, making sure that person, if they're coming in close contact to employees, are adequately protected with personal protective equipment. Perhaps self-administer when possible. Utilize those self-screenings. Making sure the area is clean and that employees feel safe when they're being screened is of a very big importance. And privacy considerations. These are health checks, and not only are those regulated by state and federal law, but you want to make sure employees feel comfortable. So to the extent that they can be done confidentially, that the results can be kept confidential, and that other employees aren't privy to confidential medical information. Those are all considerations to keep in mind. Next slide, please. The last major topic I'll talk about with respect to the mandatory safety standards is the self-certification requirement. So in Phase 2, as with Phase 1, a business must develop a written COVID-19 control plan outlining how its workplace will prevent the spread of COVID-19 during Phase 2. These materials, and I'll show you on the next slide what the control plan looks like, but they're available at mass.gov/reopening. The control plan is something that can be kept internal. It doesn't need to be submitted for approval or anything like that. But it should be retained in case an inspection or investigation happens. And the control plan kind of checks off the four major categories that we talked about. The four major safety protocols, which are social distancing, hygiene protocols, staffing and operations, and cleaning and disinfecting. In addition to the control plan, all employers will be required to sign an attestation poster, signing off that they're complying with Massachusetts law related to COVID-19. And there are additional requirements for employer and worker posters that should be posted in the workplace, and that describe the rules for social distancing, hygiene, cleaning, and disinfecting. And again, here, if you're operating an essential business that's already been open, you'll have until June 15th to comply with the self-certification requirements. Next slide, please.
And Chris, that June 15th date is assuming that Phase 2 starts on June 8th.
Right.
Otherwise, it's a week.
Exactly.
It starts.
Exactly. It's a week after the beginning of June 8th, which may be June 15th. This is just a quick look at what the control plan looks like. It's a 2-page document. You can see it's fairly simple, and it checks off those 4 major categories. You're complying with Massachusetts COVID-19 laws. And the next slide is the compliance attestation poster. This is also required to be signed and posted, and you can see here that you can check off that you're complying with the governor's order. So so these have been the mandatory safety standards across all industries, and now we're going to dive into the sector-specific protocols for restaurants, hotels, retail, and childcare. And Ariel will kick us off with restaurants.
Thank you, Chris, and good afternoon, everyone. So as you've heard, restaurants may provide outdoor table service at the commencement of Phase 2. Restaurants will be authorized at a later date and by a subsequent Phase 2 order to commence indoor table service if the public health data reflects continued positive progression. And in the governor's executive order earlier this week, the order defined outdoor table service as follows. It'll include service that is outside the restaurant building envelope, including sidewalks, patios, decks, lawn, parking area, or other outdoor space. In addition, outdoor table service may be provided under coverings such as an awning or table, umbrella, or other covering for protection from the elements, provided, however, that at least 50% of the perimeter of any covered dining space must remain open and unobstructed by any form of siding or barriers at all times. So that's sort of an important part of your ability to provide outdoor table service. I wanted to let folks know that there is a piece of legislation making its way through the State House. It was in the House of Representatives as of Tuesday. It's called the Restaurant Relief Act. And what this piece of legislation would do, among other things, is streamline the licensing process for restaurants seeking permits for outdoor dining. In addition, it's going to add a feature that you can sell to-go cocktails at takeout orders, and it would cap fees collected by third-party delivery companies at 15%. I tried to see if I could find out if there was a vote on the bill Wednesday prior to the seminar, but I wasn't able to get a result. But it's got a ton of support, and really the main purpose behind it is to allow restaurants to get a quick access to outdoor dining. The usual process, as some of you may know, before the ABCC can take anywhere between 7 to 10 weeks for approval. So keep a lookout for developments on that front. So as Chris and Dan explained, each industry has its own safety standards, and these are mandatory safety standards. And so we're going to go through these right now for restaurants, but it's important to note that these standards apply to all seating areas. So currently it'll be outdoor only, but when indoor dining is available, these same safety standards will be applied to indoor dining. And the standards make clear that even when indoor table service is permitted, restaurants are going to be encouraged to structure their operations to operate as much as possible through outdoor table service and to strictly limit indoor table service in order to assure effective compliance with social distancing and some of the hygiene and other protocols that Chris went through. And so you can see on this slide, some of the industry-specific requirements for restaurants. I did want to note that for restaurants, the safety standards require face coverings for all customers and workers at all times, except obviously when a customer is eating, or except where an individual is unable to wear a face covering due to medical conditions or disability. And so there's nothing in these standards that waives this requirement vis-a-vis outdoor seating. And so while you must try to maintain 6 feet of distance in your tables and around high foot traffic areas. You'll need to keep in mind that the mandatory safety standards require face coverings for all customers, even if seated outside, and certainly for all workers. In terms of hygiene, some of the sort of the noteworthy items are listed here. Condiments and other products may not be preset on tables, and they must be provided upon request and in single-serve portions. Menus have to be provided either in a disposable single-use format or displayed electronically or viewable on a mobile device. And utensils and place settings must be either single-use, sanitized after each use, and tables can't be preset. So the turnaround time, and you'll see from the last bullet on here, your ability to turn tables quickly outside is going to be impacted by these rules. So not only will the tables and chairs and surfaces have to be cleaned between every seating, but you'll have to set the tables once your guests are seated at the tables. In terms of staffing and operations, it's mandatory that where possible, and so I guess it's not mandatory, but where possible, you should be trying to get customers to make reservations or call ahead regarding seating. Managers have to ensure that diners that are waiting for a table don't congregate in common areas and form a line with sufficient social distancing. Restaurants may not provide customers with buzzers or other devices. Instead, you'll have to think about no-touch methods of communication, such as either audio announcements, text messaging, notices on a video screen, phone calls on cells. We'll talk about there's a benefit to considering using cell phones and text as a way to communicate with your guests as they wait for a table, and that we'll touch upon that when we talk about contract tracing. All of the industries will require training be provided to workers on up-to-date safety information, and Chris touched upon that. So having a robust training program ready to go before your workers return is a requirement. Similarly, as Chris said, restaurant operators should establish adjusted workplace hours and shifts to minimize contact across workers and to obviously reduce congestion. Similarly, you have to limit visitors and vendors on site, and you'll have to arrange for shipping and deliveries in a designated area. One difference in the restaurant-specific safety standards from the general standards that Chris was talking about is that in the restaurant mandatory safety standards, restaurants must screen workers at each shift by ensuring the following, and it follows questions that you're now familiar with from the CDC in terms of, is the worker experiencing any symptoms such as a fever, 100.3 and above, a cough, shortness of breath, or any of the symptoms of COVID-19. You'll have to screen and ask for whether a worker's had close contact with someone who's been diagnosed. And in the safety standards, close contact is defined. So it's important that you look at these safety standards. So I won't repeat all of the elements of the screening because they are very similar to what companies have been doing both as essential businesses and as non-essential businesses have begun to open up. Obviously, anyone showing signs of illnesses, the safety standards say, may be denied entry to the restaurant. Lastly, it's important, and Chris touched on this, the safety standards say that you must designate a person in charge for each shift to oversee implementation of the guidelines in the restaurant-specific standards. So I talked earlier a little bit about using cell phones or text messaging. One of the best practices that we recommend, and frankly the safety standards recommend them as well, is when taking reservations or seating walk-in customers, you should take and retain a phone number for either the individual being seated or for the party to use as possible contact tracing should you have someone who is either COVID-19 positive or presumptively positive. And then before I move on to the next slide, I want to talk a little bit about cleaning and disinfecting, because there's a provision in the restaurant safety standards that is, I think you'll see, a little bit more prescriptive than for hotels. So in the safety standards, it does say very clearly that in the event of a presumptive or actual positive COVID-19 case of a worker, patron, or vendor, the restaurant must be immediately shut down for 24 hours and then must be cleaned and disinfected in accordance with current CDC guidance before reopening. And so you'll see when we talk about hotels, that's a little bit different. That's more stringent. And so obviously, as a best practice, as you look to reopen, you ought to have a relationship. You certainly have relationships with companies that do overnight cleaning, but you should explore and make sure that your relationships with cleaning crews, they have the ability to do the kind of deep cleaning and disinfecting that the CDC requires in case of a COVID-19 positive case. All right.
Hey, Ariel,
so
Ariel,
yes.
Just before you move on, I just wanted to note something on the restaurants. When Chris spoke earlier of the screening questions that you can do as a best practice, we were using the CDC guidelines, which have a 100.5 temperature line and above is considered a fever. For whatever reason, the Commonwealth of Massachusetts for restaurants, which is one of the only sectors requiring screening, they are using 100.3 as the fever mark. So
right.
If you see an inconsistency, it's the CDC is 100.5, but if you're a restaurant in Massachusetts, it should be 100.3 that you use.
And maybe two other quick points, which is we've seen in these industry-specific safety standards a number of references, and I'll talk about it on the hotel side, but it applies equally to the restaurant side. There are a lot of references to ventilation. And obviously, when you're seated outside, that's not necessarily relevant. But as we get closer to indoor reopening, there's a lot of focus on maintaining adequate ventilation of enclosed spaces. And the standards talk about keeping windows open where possible, opening doors, looking at changing filters to high efficiency filters. And so that's something, even though the focus today is on outdoor seating, you ought to be thinking about the ventilation of your restaurants, particularly as it gets to the kitchen, because you'll have noticed what's conspicuously missing from the safety standards for restaurants is any mention of what to do in the kitchen. Although presumably all of the standards in terms of social distancing and hygiene and staffing and operation and cleaning apply equally to the kitchen area. But we know that kitchens sometimes can be cramped and they can be small, and so it will be difficult, if not impossible, to maintain 6 feet of separation of the entire kitchen staff. So the concept of ventilation is important. The concept of staggering your staffing is important, and allowing people to take breaks outside, I think, is important. And then lastly, before we go to hotels, they don't talk about it on the restaurant safety standards. They mention it in the hotel standards, but I wanted to touch upon it. Obviously, pre-meals and pre-shift meetings, you'll hear on the hotel side that the safety standards encourage employers to try to have these meetings virtually or in areas where you can socially distance. And so you should be creative in thinking about how to conduct your pre-meals. and whether they're done virtually, whether you try to tape them and distribute them through videos or YouTube, there are lots of ways you can try to handle this to minimize close social contact at the beginning of the shift. All right, so going to hotels. Hotels, motels, and other lodging businesses will not be able to, you'll see sort of before you the list of restrictions on operations, and the hotels won't be able to expand these operations until authorized to do so. And the restrictions that would apply, or the safety standards that would apply, for example, to a restaurant located in a hotel, you would have to turn to not only the hotel safety standards, but you're going to have to meet the restaurant mandatory safety standards for that kind of location. So as you can see from this slide, there are no events or meetings, anything that would involve gatherings of 10 or more people are permitted. So ballrooms, meeting rooms, function halls, all of those remain closed, and gatherings such as weddings or business events also remain prohibited. And as I said, on-site amenities like restaurants or pools or gyms have to be operated in accordance with the orders in place for those type of locations. What's interesting, as you see here, is that the hotel must inform guests at the time a reservation is made and at check-in that Massachusetts urges, and that's the key word here, urges travelers to self-quarantine for 14 days when arriving from out of state. That term urges is not mandatory, it's not required, but this is an instruction that will have to be given both at reservation and at check-in. So what is also noteworthy here for social distancing for hotels is that face coverings are required for all workers and guests when inside hallways and common areas, except when an individual is unable to wear a face mask due to a medical condition or disability. Guests should enter through doors that are either propped open, and if possible, or automated in some way, and if it has to be manually operated by a doorman or another employee, that individual has to have the ability and must frequently wash hands or use a proper hand sanitizer, as Chris described earlier. There's a limit to the number of individuals riding in an elevator to ensure, and you have to ensure the use of face covering in elevators. What we've seen in most buildings, most office buildings who have already begun to open up, is that elevators, standard size elevators are limited to 4 people in an elevator, typically standing in the 4 corners of the elevator wearing face masks. Obviously, your hotel employees should be instructed to avoid handshakes and similar greetings. And to the extent you've got valet service, workers should not open the doors of cars or taxis. Valet parking is severely limited. It's limited to operations that are necessary due to physical or geographic constraints in order to accommodate an individual guest with a disabling condition. So, some hygiene protocols. It seems at this point obvious, but important that your employees understand that they are to limit the sharing of any handheld equipment, whether it's phones, working at desks, workstation, tools and equipment that they may be using. So part of your return to work and opening is to think through how those employees who may be sharing equipment, how you either minimize that or implement frequent hygiene and sanitation and cleaning of the equipment and washing of hands. The safety standards require that you discontinue the use of shared food and beverage equipment in lobbies, including the shared coffee makers. you have to close any manually operated ice machines, or if you have hands-free machines, you can use hand-free machines. Again, in terms of sort of staffing and operations, the type of training that Chris talked about and that I talked about for restaurants applies equally to employees of hotels. And workplace hours and shifts should be adjusted to minimize contact across workers and to reduce congestion. Chris talked about this, staggering staff meal breaks and meal times, and trying to regulate the number of people in common spaces or in break rooms to ensure at least 6 feet of physical distancing. We talked about daily pre-shift meetings should be conducted virtually or in areas of social distancing. Should minimize and even consider closing down shared touch surfaces like kiosks or those stations where folks can check in for their flights, shared pens, and things of that nature should be, if not eliminated, reduced, and should be accompanied by the ability to sanitize those items. One of the interesting things in sort of unique to the hotel space is in sort of the cleaning and disinfecting area, the health standards or the safety standards are very specific about how dirty linen should be dealt with. And so the standards require that dirty linen should be removed and transported from guest rooms in single-use sealed bags, and pillow protectors on guest room beds should be changed in between guests at a minimum. Bagging of these items should be done in the guest room to eliminate excess contact while being transported. And all bed linen and laundry should be washed at high temperature and cleaned in accordance with CDC guidelines. Now, that may end up not being, for many of you, much of a change in practices, but it's a very specific requirement contained in the safety standards. Furthermore, following each departure of a guest from a room, it says that you should consider leaving the guest room vacant for 24 hours as part of the cleaning protocol to allow for deep cleaning, disinfectant, and cleaners to dry, and reasonable air exchange. So that's a suggestion as opposed to mandatory. What's also interesting is that you're required to keep cleaning logs that include date, time, and scope of cleaning, and that actually applies equally on the restaurant side. And in the hotel context, in the event that a guest presents a presumptive case of COVID-19 or a positive case, the room used by that guest may only be returned to service after undergoing an enhanced sanitation protocol in accordance with CDC guidelines. So unlike restaurants, which will be shut down for 24 hours, if a hotel has a guest with a positive case or a presumptive case of COVID-19, that guest room has to be taken out of circulation until it undergoes the enhanced cleaning and sanitation process required by the CDC. And with that, I'm going to turn it back over to Chris to talk about retail.
Thanks, Ariel. So I'll talk about the sector-specific requirements in the retail setting. And as many of you know, curbside pickup has been allowed in recent weeks. Phone and internet order fulfillment has been allowed, but now we're actually talking about opening our doors and allowing in-store transactions. Let's go to the next slide. One of the highlights of the retail sector-specific requirements is the capacity or occupancy limits. So each retail store must monitor entries and exits and limit occupancy at all times to the greater of either 8 people per 1,000 square feet of accessible indoor space, or 40% of the retail store's maximum permitted capacity under its occupancy permit. If you don't have an occupancy permit, go by 8 people per 1,000 square feet. And these calculations include both customers and workers, so it's fairly restrictive. Go next slide, please. The rules for enclosed shopping malls and indoor multi-tenant retail spaces are a little bit different. Operators of enclosed shopping malls and other indoor multi-tenant retail spaces, like with the retail stores, must monitor customers and worker entries and exits to common areas. But with respect to shopping malls and multi-tenant retail spaces, the rule is you must limit occupancy to 40% of the maximum permitted occupancy levels. And this again includes customers and workers in those calculations. With respect to malls and these types of settings, in places that serve food can only during phase 2 provide takeout and delivery services. Seating areas like food courts, children's play areas, and arcades must still remain closed under phase 2. Next slide, please. So there are a number of retail-specific precautions that must be made or kept, and they include putting markers. So with the capacity limits, it's likely that there will be lines. Hopefully there'll be lines lining up outside the store. And so putting markers outside the store to ensure 6 feet of distance while customers are waiting. You've probably already seen that at your local grocery store. If the store offers non-in-store options like delivery, curbside pickup, or appointment-only shopping, customers should be encouraged to use those methods before coming into the store. Note, however, for in-home delivery of products, if you're delivering furniture, appliances, whatever it may be, these types of businesses are required to screen customers for symptoms prior to sending employees into that workplace. Into the home, and they must delay delivery if the customer indicates that a COVID-19 positive person is in the household. With respect to grocery stores and retail stores with a pharmacy, as with before, at least 1 hour of the day must be dedicated for individuals in vulnerable groups, and these hours should be conspicuously posted. Next slide, please. So the golden rule is to maintain 6 feet of distance where possible, and there are a few retail-specific considerations. So I just want to go through a few of them. Contactless payment is required. Is a best practice, of course. Closing and reconfiguring the workplace, that'll be unique to retail spaces. Reconfiguring the workplace to allow social distance is required. This might include, directional signals or barriers near checkout lines, those types of things. The shifts and hours we've already discussed. Masks are required by both workers and customers, and there should be postings indicating this requirement. Of course, except if wearing a mask by either an employee or a customer would be unsafe due to a medical condition. And retailers must close, open food options like self-serve food stations, and also must eliminate for now, at least for phase 2, samples, taste testing. If it's a clothing store, dressing rooms cannot be open, and employees may not try on clothes at the store. If it's a type of department store, perfumes and lotions and makeup and things like that cannot be applied in the store. Next slide, please. With respect to cleaning and hygiene, a few retail-specific considerations. Of course, you're not sharing, either not sharing or sanitizing the shared equipment like tag machines and cash registers. Retail stores are required to prohibit reusable bags. And so in places like Boston, Cambridge, a few other towns and cities have outlawed plastic bags in the past. That law is not in effect at this moment, and plastic bags are permitted and should be used, or paper bags, whatever it may be. In terms of cleaning the heavy transit or high-touch surfaces in the retail space, this might include baskets, carts, common areas where employees congregate, or used to congregate, anywhere there's heavy traffic and things like that. Next slide, please. So in addition to grocery stores, which are required to offer exclusive hours for certain populations, other retail stores are encouraged but not required as a best practice to offer exclusive hours and accommodations for vulnerable individuals. They should notify, as a best practice under the Massachusetts ordinance, the local board of health in the event of a positive case. And workers who are particularly vulnerable to COVID-19, due to age or underlying condition, are encouraged to stay home. So as an employer, you might want to think about your accommodation policies, work from home where possible. I know it's not as possible in the retail setting, but the state is focused on, protecting the older individuals, those with underlying conditions, and so that's something that the employer should be sensitive to. And of course, as we discussed, workers are strongly encouraged to self-identify symptoms to the employer so that the employer can take precautions and cleaning. And with respect to training, the next slide, please. In the retail setting, of course, we're providing training to workers, preferably before June 8th or before whenever phase 2 starts. Dan mentioned at the top, you're permitted to allow workers on the premises now to get ready for phase 2. So perhaps conducting that training now, making sure employees know what to do when they do get back to the workplace, is really an important factor. The training should be, and the last point I'll make on retail, the training, as we talked about a little while ago, the CDC and the state regularly update COVID-19 related restrictions. So the training should be updated, and employers should keep their employees informed of any changes in conditions or restrictions. Now I'll turn it over to Emily to talk about childcare and camps.
Thanks, Chris. And before we jump into this section, I am going to provide the CLE code at this point, and that is SS, as in Seyfarth Shaw, 3097. SS 3097. And we will be circulating a CLE form after the presentation, so look for that in your inboxes either today or tomorrow. So we're going to pivot now to talking about the Phase 2 health and safety standards for child and youth serving programs. This is daycare, summer camps, and the like. This does not apply to overnight camps. We will look for those in Phase 3. Where are we now? So today we're operating under the emergency childcare system, offering care to essential workers and those who do not have a safe alternative to group care. As we move into Phase 2, where childcare providers can reopen subject to specific health and safety standards, that emergency system is going to be phased out. On Monday this week, these Phase 2 standards were released for child and youth serving programs. The document totals 32 pages, which makes sense when you consider the unique challenges that these programs will face in implementing the types of protocols we've been discussing. Ensuring social distancing with adults is challenging. Ensuring social distancing with kids is another ballgame. So for this portion, I'm not going to get into the minutiae, though if you're interested, we're here and happy to help provide guidance. Instead, I want to hit some highlights that may impact a broader swath of employers, like those whose workers may rely on programs like daycares and summer camps to watch their kids while they're at work. The release requirements are extensive, and the EEC came right out in the beginning of the document and said that family child care providers, this is people providing care out of their homes, are going to face particular challenges complying with them. Those will become clearer as we move through this portion, but I want to raise it now because it's possible that workers who rely on family child care services may need to find alternative care, at least for a little while longer. So first, there's the plan. These programs are going to have a plan in place for complying with all of the relevant health and safety standards. They're going to have to submit that plan, and a template document is going to be provided by the EEC. It's not available yet. And it will be an attestation approval process. I understand what I need to do, and I'm prepared to do it. When you look at the list of required protocols here, these aren't different requirements from the industries we've been discussing, but what they mean for child and youth serving programs is a little different. Chris walked us through some of the general cleaning protocols, and for this group, the requirements are even more demanding given the frequency with which their clients are touching things, moving from one toy to another, sharing things, and more. When it comes to the use of masks for face coverings, that's a toss-up with this group. It's recommended for children over 2 years old who are in a situation where they can't stay 6 feet from others, but it's at the guardian's discretion. Staff are required to wear masks if 6 feet of distance cannot be maintained. When it comes to 6 feet, these programs do need to have a plan in place for keeping everyone 6 feet apart. Space-wise, that means that programs must have a minimum of 42 square feet per child to ensure that social distancing is possible, with a recommended 144 square feet per child. And then I really want to hit home the symptom screening for this industry. So first of all, staff, parents, and children will be directed to self-screen at home before they come to the program each day. And that self-screen includes a temperature check. And then once they arrive to the facility, before children are allowed to enter the program each day, they will have their temperature taken with a non-contact thermometer. In this instance, if throwing another fever temperature in the mix isn't too confusing, a fever is considered anything 100.0 or above. A staff member is going to conduct a visual inspection, and the child and guardian will both be asked, assuming the child's old enough to respond, if in the past 24 hours they or any member of the household has had a fever, felt feverish, chills, cough, sore throat, run through those symptoms that Dan showed us. And guardians are going to have to sign a written attestation each day as to the truth of what they're saying about those symptoms and potential exposure. If the answer to any of those is yes, the child must be sent home. So this may be stating the obvious, but some kids get sick a lot. So you can imagine the impact this could have on your workforce. And so again, it's prudent to prepare for the absences that may result. In terms of the preparations, moving through this quickly, we talked about social distancing, square footage requirements. Beyond those, these programs may well need to reorganize the physical layout to promote individual play and social distancing. If possible, these programs are instructed to close communal spaces like game rooms and dining halls. And if that's not possible, they're to stagger use and disinfect between uses. Staffing could be another challenge because these programs will need more staff to ensure compliance with all these requirements. So for instance, for preschool age kids, the staff ratio is 2 staff to 10 kids, and that's also the maximum group size. And I looked it up, and pre-COVID, the ratio for that same group was 1 staff to 10 kids. If staff get screened out in the morning, if staff get sick throughout the day, it could pose another challenge to maintaining operations. What won't be happening, you see that in the right column here. Field trips, mixing with other groups, games like tag, sandboxes, water tables, use of cloth toys. And then there are just 2 more items I want to call your attention to with respect to this group. The document contains specific minimum requirements, which we have not gone into here, for programs that provide services to children with special needs, vulnerable children, and infants and toddlers. And the document also contains some modified requirements for recreational camps and programs. And so you'll want to take a look at the document if you're particularly interested in those groups. And finally, as I mentioned up front, residential camps and overnight stays are not permitted in Phase 2. Those overnight camps may, however, be opening in Phase 3. And so at this point, we expect that Phase 2 will last at least 3 weeks. And again, we expect that Phase 2 might begin on June 8th. And so that would mean that Phase 3 would begin at the earliest on June 29th. So these are some of the industries that are poised to reopen in Phase 3. And I do want to point out with this first bullet point on post-secondary, higher ed, vocational tech, they are allowed to reopen in Phase 2 for limited purposes, but they will not be reopening for general operations until we hit Phase 3. And so we're now going to move into the Q&A session of the program. To kick that off, I'm going to turn it back over to Michelle, who's going to provide some instructions before Dan leads us through the Q&A.
Ladies and gentlemen, at this time, we will conduct a question and answer session. To ask a question via the web presentation, just type your question into the text box on your screen.
Okay, well, while we're waiting for any questions to come in, we did receive a few questions during the program that we were able to answer directly. I also wanted to clarify a couple of things. I misspoke earlier when I referred back to the fever line. The CDC line that we mentioned in the screening slide is 100.4, whereas the Massachusetts screening line for restaurants is 100.3. I had inadvertently said 100.5 for the CDC. It's 100.4 that the CDC recommends, and then specific in Massachusetts for restaurants, the screening is 100.3. One other thing we wanted to clarify in restaurants, Ariel mentioned the requirement for customers as well as employees to wear masks at all times except when customers are eating. In the restaurant standard sheet that the state has provided, they have the general requirement, as Ariel stated it, but then in typical confusing fashion, under best practices, recommended best practices, they do clarify that customers may remove masks while seated at their table. So they don't necessarily have to have it on while they're at their table, even if they're not eating. There's a little bit of inconsistency there, but I think we can trust the best practices that they've recommended, that customers may remove the face coverings while seated at the table. They will need them in the restaurant to get to their table and to exit. But once they're sitting at their table, they may remove those face coverings. Okay, let's see if we've got any questions. We don't have any questions coming in. Like I said, we did address a couple of specific questions during the program specific to, there was a question just to review for others while we're waiting for any other questions to come in. There was a question whether hotel pools, indoor pools, when they would be opening, and that will be during phase 3 because it's an indoor pool. It'll be regulated like other indoor pools. Another question asked about indoor water parks or theme parks, and we believe that those are listed as reopening in phase 4. Otherwise, there was a question about car dealerships and showrooms, whether they're subject to retail and able to open in phase 2, and our belief is that yes, they would constitute retail since they can be the purchase and sale of automobiles, and they would be subject to the retail restrictions of phase 2. We've got some extra time, but we don't seem to have any questions yet, so we won't keep you. If anyone has a question, now is your chance to send it in under the questions tab. If not, please feel free to reach out to any of us or any of your other contacts at Seyfarth with questions or issues as you really put your planning into place for phase 2. We'll keep you posted on any developments, both for phase 2 and phase 3, or any other changes. As we mentioned at the outset, the expectation and word on the street is that Governor Baker will make an announcement on Saturday as to whether phase 2 will start on time on Monday, being the 8th. Potentially could be later, but hopefully on Saturday we hear that phase 2 will commence on Monday. With that, with no further questions, thank you all for attending. The slides will be available to you, as will be a recording, and I'll turn it back over to Michelle. Thank you.
This concludes today's webinar. Thank you for attending.